Unlike anywhere else in the world, or many of the other countries in the world, the number of HIV cases are increasing. So this year we had over 121,000 new diagnoses of HIV. Now, not everyone who has HIV gets diagnosed. So if we take into consideration the people who weren't tested, we've estimated there's about 170,000 new infections in Europe. And this gives us an overall total of about 2.3 million people living with HIV in the European region. And although the pattern varies quite a lot between the countries, generally speaking, we know that approximately twice as many men as women are HIV infected. With regard to treatment, the good news is that if people get treated early enough, they can have the same life expectancy as someone who doesn't have HIV. The bad news is that in the European region, not enough people are getting treated and are not getting diagnosed and are not getting treated. So about half the people who are diagnosed are being diagnosed very late, which means they can't get the full benefits of treatment. And that's actually reflected in the number of people who go on to die of AIDS, because no one needs to die of AIDS with the treatment if they get the treatment early enough. Unlike many other places outside of Europe, the number of AIDS deaths are actually increasing in Europe. So the treatment saves lives as long as it's used and introduced early enough, and that's why we keep emphasizing the importance of universal access to early diagnosis and very timely treatment. The trends vary between the different regions in Europe, but across Europe, in all European countries, HIV always affects the most vulnerable and marginalized populations. And in Europe, these are the men who have sex with men, people who inject drugs, prisoners, sex workers, and migrants. In the west of the region, of the European region, it's mainly men who have sex with men, but also some heterosexual transmission. In the east of the region, it's drug injectors, but also increasingly the partners of drug injectors who are getting the virus heterosexually. That means that each part of the region really needs to intensify its work with these highly vulnerable and marginalized populations. And it's absolutely vital that HIV services are maintained, even in this period of economic austerity and the economic crisis that many countries are facing. So the effects of scaling down services or stopping services can be catastrophic. We've seen examples in Europe, in Western Europe, where there's been a tenfold increase in the number of HIV infections in drug injectors because services have been cut or scaled down. And these are in countries that previously have been able to stabilize their epidemics. HIV is linked to other conditions in the European region. Firstly, tuberculosis. The risk of developing tuberculosis is far greater in people who have HIV, especially if that HIV infection isn't treated. In Europe, TB is actually one of the leading causes of death among people who live with HIV. A second important condition is hepatitis, particularly hepatitis C. Estimates have shown that almost half of those living with HIV are also chronically infected with hepatitis C virus, and having both conditions can lead to life-threatening liver failure and, in some cases, death. And increasingly, we're going to see tens of thousands of unnecessary deaths from hepatitis C in the years to come. A third important condition is drug dependence, particularly injecting drug use. Injecting drug users are very important. The HIV epidemic is concentrated in drug injectors, particularly in the eastern part of our region. And a person who uses drugs or injects drugs is much more likely to have other infectious diseases like tuberculosis and hepatitis C, and those conditions are exacerbated by their living conditions. They're often poor, they're homeless, and they lack access to health care. Another important factor in this is that drug injectors often end up in prisons, which are particularly high-risk environments for the transmission of HIV, for tuberculosis, and for hepatitis C. Antiretrovirals can be used in many different ways. For example, antiretrovirals are used very successfully to prevent HIV transmission from pregnant women to their babies. If an HIV positive woman is using antiretroviral therapy in a timely way, the risk of HIV transmission to the baby can be reduced to less than 2%. But there are other ways that we can use the antiretrovirals. Research published in 2011 has shown that the sexual transmission of HIV can be reduced by 96% through treatment of the HIV-infected person. As long as that treatment is done early enough and at the correct levels, the risk of sexual transmission is reduced by a huge 96%. Another study has shown that people who aren't HIV positive themselves, but have an HIV positive partner, can reduce the risk of their exposure to HIV by 73%. So these findings show that the combined preventative effects of antiretroviral therapy can very much decrease transmission, but of course increases the number of people who might need access to the medication. WHO is now recommending that antiretroviral therapy should be given to the HIV positive partner irrespective of the state of their immune system, because there are these positive gains, these gains in prevention. And for quite a long time now, WHO have been recommending the use of antiretroviral therapy in cases where people have been exposed to the virus through a finger prick in a hospital situation or through sexual intercourse. This is where antiretrovirals are used as post-exposure prophylaxis. But it's important to point out that post-exposure prophylaxis can never be 100% effective, and it should be never provided in isolation, but should always form part of a wider strategy for preventing exposure to HIV. WHO Europe is actually leading on actions to tackle HIV epidemic in the European region. And we have developed a European action plan on HIV/AIDS, which has been endorsed by the 53 member states of the European region. It lays out some quite specific actions in four main strategic directions, four main areas. The first is concerned with improving HIV diagnosis, treatment, care and support. The second area looks at how HIV is related to other serious diseases such as TB, hepatitis and drug dependence, and looks at how those services might be improved through integration. The third area is with regard to building strong and sustainable health systems that are able to respond to the HIV epidemic. And fourthly, the action plan looks at things a little bit outside of the health system. The social conditions, for example, that people are living in, and barriers to treatment, and looks at ways in which those barriers may be overcome. So every year, WHO Europe, together with the European Centre for Disease Prevention and Control, publishes all the cases, a surveillance report that includes all the cases in the European region. And this information can be used to tailor the response. WHO also develops guidance and recommendations on specific areas, including treatment and testing and diagnosis. And also WHO provides advocacy and guidance to governments. WHO and national authorities, together with partners in civil society, need to continue to work together to offer the best services and treatment possible to the 2.3 million people living with HIV/AIDS, but also to provide protection to those very vulnerable populations that are at high risk of HIV/AIDS.